Hi everyone, my name is Kristen Mayorga. I am here to talk about the mental health disorder known as anorexia nervosa. And my target group are the ages from 13 to 18 years old. Let us go into some basics of what anorexia nervosa actually is. So, by definition, anorexia nervosa is the irrational fear of gaining weight. It has to do with body image issues, and there are actually two different types or subgroups of anorexia nervosa, which include the restricting type as well as the binge eating purging type. So, for the restricting type, we can see an example as the picture I presented to the left. It talks about, I won't eat, I'm fat. So, what some anorexic individuals would do in the restricting category is that they won't allow themselves to eat. Even if they are hungry, they still restrict themselves of food intake. The second is more of a binge eating slash purging type. So, what binge eating has to deal with is that an individual will deprive themselves for a period of time and then they'll go into a period of just complete consumption of food all at once. But the purging aspect is what most people would consider is vomiting. So during this binge eating cycle where they just consume a bunch of food, they will go into usually secret and they will make themselves throw up so that they won't be intaking any of the additional calories. So now that we've talked about some basic definitions of anorexia nervosa, I wanted to discuss some common characteristics of what anorexic individuals actually entail. So some ones that I've listed are the four basic ones, which include self-starvation, food obsession, compulsive exercising, and lack of a period for women. So the first characteristic in self-starvation is exactly what it mentions. So these individuals will literally deprive themselves of eating and they will starve themselves. Even if they know they are hungry, they just refuse to eat. The second characteristic is food obsession. So even though anorexic people aren't eating, they are definitely conscious of what food they observe, or even if they're doing the binge purging type, they want to know what type of food they're eating and things like that. The third common characteristic is compulsive exercising. So usually when anorexic individuals are seen and diagnosed, they are extremely thin. And what tends to be a common characteristic is that these people will be not eating as often, but they'll be exercising a lot to try to compensate with their fear of gaining weight. So if they do happen to eat anything, they will just continue to exercise as often as they can. The last characteristic is definitely generally only towards women or females or any of the girls present in this room. So the last characteristic is the lack of a period for women. And this is seen for anorexic women just because due to hormonal imbalances and just nutritional imbalances, this decides to affect the puberty of women and not allow them to menstruate as they normally would. So now that we've discussed some common characteristics, I want to look at some common symptoms. And when I say common, I don't really mean common. They are quite complex. The symptoms of anorexic people can vary from person to person. A lot of it has to do with how a person grows up. So, but some main common things that people will see with anorexic individuals are that they are extremely thin. So, some extreme thinness that is observed through the body. So, a person may look, you may be able to see some rib cages, or you can just tell that the person seems very thin for their height and their body weight. Another common symptom is low self-esteem or image of oneself. So, what this means is that the person doesn't view highly of themselves and is dealing with a lot of issues that have to do with themselves. Another common symptom is their mistrust of others. So a lot of the times that anorexic people are trying to deal with their own mental disorder is that they don't trust other people to help them. So now that I've described some basic characteristics, symptoms, and definition of what anorexic individuals are, I just had a true and false question that I wanted to ask all of you. So my question was, true or false? Only girls can be considered anorexic. And if your answer was false, then you are correct. Girls and boys are both at risk for anorexia. But the main difference is that girls have been diagnosed more as anorexic as compared to boys. But boys, you are still at risk and you can also be considered anorexic. So now that we've established that both boys and girls are at risk for anorexia, I just wanted to address some major health risks that are physical as well as emotional. Some common physical health risks include extreme thinness, irregular heartbeats, teeth decay, and it also many be fatal and may result in death. Some emotional health risks include depression, suicide thoughts, struggle for control. The physical aspects, when I mean in terms of death, is that when people restrict themselves from food, they are severely malnourished. And due to restricting themselves from food, they may have this built-up of imbalances in nutrition. And that could affect your heart, and it could have your heart beat irregularly, which may result in death. Another thing for the binge purging subgroup is that when you tend to vomit or make yourself throw up, that a lot of your stomach acid is starting to what's called erode and um, basically affect the enamel in your teeth. So your teeth will start to decay due to the acidity from vomiting. When I talk about the emotional health risks that are associated with anorexia, the common ones include depression, which may lead to suicide thoughts. And another thing is the struggle for control. A lot of people are struggling to be able to get through this mental disorder. It is a very big mental capacity that has to deal with these things. So a lot of people may be depressed, and the depression may get worse if it's untreated. So a lot of people may tend to have suicide thoughts. So again, my emphasis is to explain why is anorexia important. And it is important because diagnosis for this among your doctors or psychologists has increased over time. And another thing is to mention the gender disparity. In terms of that, I mean females are more likely to be considered anorexic than males. And we need to figure out how to treat these kinds of things. So again, if one is considered to be anorexic, it is not an all end all be all. There are many different intervention strategies to help with people who have to deal with this mental disorder. A lot of it is involved in our community. So there are various therapy options available as well as counseling that is available through your school as well as through your community. Another thing is nutritional rehab centers. And what I mean by this is that people who have a severe case of anorexia may be medically diagnosed to attend one of these rehab centers to try to gain their weight back. Another final option could be for the medication. Medication may be able to help with depression for people who try to do everything possible, but medication is needed. Another state or federal strategy that is offered is that there is a institution that funds these kind of adolescent research studies to help us with understanding how children between the ages of 13 to 18 deal with eating disorders such as anorexia nervosa. So based off research what I could find, my personal recommendations for research about anorexia nervosa amongst adolescents between the ages of 13 to 18 is that there needs to be better research, because the problem is a lot of these eating disorders are just grouped together, and it's not fair to understand how anorexia nervosa is different from, let's say, bulimia nervosa or binge eating disorder. So there needs to be better research. Another recommendation that I have is to have cultural sensitive intervention plans. And what this technical means is that so every person is different and every person values their own different cultures. So just because a Latino individual may not have the same type of culture upbringing as, let's say, an African American child. So I feel that there needs to be more culture sensitivity into how eating disorders are viewed amongst different cultures. Another recommendation I have are to have psychologists readily available at schools. I am not very aware if there are even psychologists that are mandated to be part of school systems to deal with these kinds of things. So finally, we're going to talk about some resources. One important resource that I found were the Eating Disorder Foundation of Orange County. This is a local organization that is located in Laguna Hills. I know that it may be similar to many other community resources, but this is the one that I found to be quite helpful. So this specific organization actually spreads awareness and prevention in schools. And they do confidential counseling as well, in addition to spreading awareness, which I felt was very relevant to spreading the word about eating disorders because they are becoming quite common. Another resource I decided to talk about was a federal agency known as the National Institute of Mental Health. So this particular agency is not located in Orange County, but it is an actual federal funded program that looks into research about mental disorders such as anorexia nervosa targeting adolescent populations. So they do their awareness of spreading the latest in mental health research, and they are the ones that we discover all the different reasons of why the, the prevalence or the existing amount of cases involving anorexia nervosa is increasing or decreasing, and how each one is categorized. So I think this is another great resource to see about different mental disorders that are in our community. And this is the conclusion to my discussion of anorexia nervosa, and I thank you all for listening to my discussion. I am quite passionate about eating disorders, especially amongst adolescents, and I hope that you were able to learn a couple new things about anorexia nervosa or to even know what it actually is, because it is a quite increasing mental disorder, especially amongst females, but also it is also seen in males as well. So I just hope you all just gain some kind of insight and you're aware of some classical cases of restricting versus binge eating and purging.